Everybody in the country understands that this is a Washington takeover of our health care. They also understand already that none of the things it was supposed to do are coming true. It was supposed to hold premiums down. Premiums are going up. It's supposed to hold costs down. Cost is going up.
All right, that was Senate Minority Leader Mitch McConnell earlier here in America's Newsroom. He hopes that some Democrats in the Senate will cross over and vote with Republicans on an amendment to repeal the health care law. That's going to get underway, we understand, about mid-afternoon today. You're going to start to see that repeal vote playing out in the Senate. Here's a look at our latest Fox News poll that shows 56% of Americans say that if they would prefer that their lawmaker repeal this health care law. 39% say that they would like to see the health care law kept. Let's bring in New York Democrat. Congressman Anthony Weiner joins me now with his response. Good to see you. Good morning, Congressman. Welcome to you.
Good morning. Thank you.
What do you make of Mitch McConnell's comments, and what do you expect will happen this afternoon in the Senate?
I don't know. I mean, it comes down to, if you're a senator, do you want to take away help for seniors to fill the donut hole gap in prescription drugs? If you want to take that benefit away, then you'd vote to repeal. If you want to vote to take away the tax cuts that have gone to small businesses to provide insurance to their employers, to employees, then you'll repeal it. And if you want to raise the cost to taxpayers by about $1.2 trillion, you'll vote to repeal. That's why I don't think it's going to get a majority today.
We saw the majority did vote to repeal in your side of the Capitol. Over in the House, it was voted to repeal. And basically, Mitch McConnell's argument, a lot of folks on the Hill have said, why even go through this process? We know that if we do get repeal, the president's going to veto it anyway. What do you think of his justification that he says, this is why people voted for us, because we promised them that we would make every attempt to repeal this law?
I frankly agree with him. They campaigned on what they're against. They said they're against the health care bill. The problem Mitch McConnell has is, what is it he's in favor of? I heard him today said he's in favor of allowing people to buy insurance over state lines. Well, that's in this bill. I heard him say he's in favor of tort reform. Well, that's in this bill.
Well, there's a lot of discrepancy about that, and not everybody's satisfied with the form that has taken, because they feel that there's not enough of that in that bill. So the president has said he's willing to open up the bill, take a look at it, make some changes in it. Is that where it's headed?
Well, look, if you quoted one poll. There have been a lot of polls, but there was a poll recently that asked people two things: one, repeal or replace, or something like implement it and improve it as you go. I think most people are in that second camp, which is why the Republicans are on the wrong side of history right now.
All right. Yeah, I want to get your thoughts on this waiver issue, because it's starting to get a lot of attention. And I want to kind of lay it out for people, because we went through, the White House's perspective on this. And basically 733 companies or entities, about a quarter of those who are receiving these waivers are from unions. There's 5 SEIU groups that are involved in it: Aetna, Cigna, Waffle House, Universal Orlando, the states of Massachusetts, New Jersey, Ohio, and Tennessee, and many others in that 733 have been granted a waiver from a specific part of this, the mini-med part of this health care reform bill. So basically, if they're already giving only up to $2,000 per person for health care, they're going to get to not have to raise the amount of coverage that they're going to give to people. What do you make of this? Why are 733 entities getting waivers when the rest of everybody isn't?
Well, first of all, here's what it is. First of all, anyone who has a plan, whether it's a small company or a big one, Fox can apply also. The whole purpose of the law, despite what you've heard people like Mitch McConnell say, is we're trying to nationalize health care. No, it's in fact to make sure that health care standards are high enough so that people aren't going on to Medicaid or coming into hospitals uninsured, pass along the expense to us. These are organizations, and like you said, they run the gambit from big businesses to big unions who already have health insurance, have gone to the federal government and say, listen, our standards are high enough. And the federal government has agreed. The mythology here that this is a big government thing is the example of how many people have been waived from the requirements is an example of that. Here's the bottom line. Fox gives you pretty good insurance. The taxpayers give me pretty good insurance. I have the same insurance plan that all federal employees have. For the people who don't, they go into hospital emergency rooms. They pass along the bill to the rest of us. We're trying to prevent that from happening.
But you're talking about the larger issue of why health care change in this country is necessary. And I think everybody agrees that it is. But I'm asking you, why would some companies, and I know, you're probably going to say, well, if you apply for it, you might get it, right? And 733 companies have gotten it. But it raises the question, why is it necessary to help anybody out of this plan if it's such a great plan?
Well, because it's not a plan. It's a set of standards for health insurance companies and health insurance plans all across the country. Mitch McConnell said earlier on your show, why don't we let people buy across state lines? Because then you could have one state that has very low standards, competing unfairly against the state that has higher standards. Okay, go ahead. I was trying to answer your question.
No, I think you are, but it sounds like you're getting off my question, which is back to this waiver issue. I'm asking, why would the federal government find it necessary to give anybody a waiver, okay, if the plan is such a good plan? And what they're saying in this email is, some of these entities would have seen their cost rise as much as 200% if they tried to cover this, premium up to the amount that they have to cover people. But, there are companies out there who are seeing their premiums go up 19%, 40%,
now I have to,
all kinds of
you see,
percentages.
now I have to interrupt you because you're not understanding what the waiver is. The waiver is from the minimum standards. Okay, well, I think I do. Let's try to explain each other's positions or explain our own.
All right.
Look, here's what the law does, and I can tell you, and you can look it up. What it does is it sets minimum standards for everyone's insurance plan.
Right.
So we don't. Okay. So the question is, some plans say, you know what? Look, I am above this section, but I'm below this section. Take a look at my plan in toto and see if it accomplishes the one goal all of us share, and that is making sure that people have health insurance so they're not going onto the public resource. They look at the plan, they say, you know what? They say, you know what?
You're right. Off by this machine because we're on a hard break. But I want to talk to you about this further. The bottom line is that some companies are getting a break on this, and people just need to understand what's going on with this mini-med thing because it's going to get more attention. I hope you'll come back and talk about it.
That's right. Or you can go to AnthonyWeiner.com and learn all about it.
Thank you. I hope people do that too. Good to have you here, sir. Welcome.